there were times where like you would see Amazon came out with their new program for their employees. And I asked somebody from Amazon, I'm like, so is this part of Haven? They're like, oh, no, not really. This is just something we're doing on our own. And I thought, well, that's interesting. That's almost what we expected Haven to do. And then they did something else around pharmacy. And I'm like, so is this in the Haven thing? They're like, oh, no, this is something else we're doing. And you start to scratch your head and go, okay, what exactly is Haven and what are they doing? And I think he captures it in that whole think tank comment. That's really what they ended up doing. It is kind of disappointing. I agree with you that it was a good pick, and I thought he was going to take it in a good direction. But I think what you saw there is you take the cultures of three very distinct companies, very large companies, and you try to satisfy too many masters there, and they just weren't able to all get on the same page. So that, I guess, is not overly surprising that ended the way it did. Any implications for health IT on this? I mean, should we read too much into this that, healthcare change is going to have to come from the provider or the payer? Is that what we should read into this? What should we read into it in terms of where change is going to come from?
That's a great question, Bill, because if you look at the ecosystem in terms of healthcare, you've got the government, obviously, that plays a role. You've got providers, which are delivering healthcare, and you got, payers in terms of insurers. And then you've got everybody in the supply chain in that ecosystem who is, providing some kind of product or services within the healthcare delivery. And then you've got, in this case, it was huge employers, right, who wanted to make a difference and make changes for their organizations and then roll it out. So really, they all have to come into play, all of those parts of the healthcare ecosystem. And, having spent most of my healthcare IT career in a provider organization, I put providers who are actually delivering the care to the patients as